After the first visit with Dr. Garcia, Lisa feels a bit better because the doctor prescribed a beta blocker, a drug used to prevent the heart from beating too fast. Although Lisa is feeling better, she is still experiencing some discomfort related to her AF. She wants to discuss other treatment options with Dr. Garcia. Dr. Garcia explains that there are different treatment options available that can help the heart chambers work together and more efficiently pump blood based on the type of AF. The guidelines for management of AF recommend getting early treatment for AF because it improves the chances that AF will not progress. There are 5 different types of AF: first diagnosed, paroxysmal, persistent, long-standing persistent, and permanent. 2 main goals for treating AF are to improve patients' life expectancy and quality of life. Patients can personally contribute to reduce the cardiovascular risk with some lifestyle changes, such as doing more exercise and eating healthy. Also, it is possible to reduce the risk of stroke by taking anticoagulation medication. AF can be treated either by antiarrhythmic drugs or by catheter ablation. Dr. Garcia thinks that Lisa is a good candidate for catheter ablation and explains the procedure to her. The main goal during a catheter ablation procedure is to electrically isolate the pulmonary veins from the left atrium. The strategy is quite simple. Lesions are created around the pulmonary veins to interrupt the electrical conduction between the pulmonary veins and the left atrium. We have 2 different possible approaches. Both techniques are used to stop AF by isolating the pulmonary veins from the rest of the heart. So let's discuss the difference between them in order to find a possible treatment plan for you. A radiofrequency or RF catheter creates lesions by heating the tissue. Point-by-point lesions are connected to form an ablation line around the pulmonary veins. This technique requires 3D mapping as well as many applications of high heat around the pulmonary veins in order to achieve complete isolation. Cryoballoon ablation creates the lesion by freezing the tissue until pulmonary veins are isolated from the left atrium. Cryoballoon ablation catheter is the only system able to isolate the pulmonary veins just in 1 or 2 applications due to its anatomical balloon-shaped design. Those treatments may allow a patient to live without atrial fibrillation. Lisa feels more comfortable knowing all the information and possible steps in her treatment process.